I'd like to firstly acknowledge the traditional custodians on the land in which we are meeting today, and I pay my respects to elders past, present, and emerging, and to any Aboriginal or Torres Strait Islander people that might be on the call with us today. I'd like to extend a warm welcome to Zoe Levin. Zoe is an accredited practicing dietitian and accredited nutritionist who brings her passion for nutrition, research, and patient care to her work with Oncore. Zoe has experience in one of Melbourne's largest public hospitals, working in oncology, surgery, eating disorders, and general medicine. Zoe has completed honours research in enhanced recovery after surgery pathways, exploring their impact on surgical patient recovery, length of stay, and malnutrition risk. She has an interest in oncology and surgical care, malnutrition management, disordered eating and eating disorder care, gut health and chronic disease management. Zoe has a special interest in pancreatic disorders and pancreatic enzyme replacement therapy. So over to you, Zoe.
Thank you, Alison, for such a nice introduction. I am going to share my screen, so just give me a moment to get this sorted. Can you see that? Yep.
We can
Great.
clear that, yep.
Perfect. Great. So hi, everyone. As Alison mentioned, my name is Zoe and I'm an accredited practicing dietitian at Oncore Nutrition, and I welcome this presentation on diet and upper GI cancers. So before we start, I would like to get a gauge of which of the following best describes you or your loved one's cancer diagnosis, which you'll see on this screen. And feel free to either share in the chat any of these diagnoses that's suited to you. Did anyone want to pop in the chat? Great, thank you, Amelia. So pancreatic. Anyone else? You can pop yourself off mute if that's easier.
Hello, I'm talking on behalf of Brendan O'Connor. He has been diagnosed with esophageal cancer.
Okay, thank you.
I did send a message, but for some reason it hasn't come through.
That's okay.
I'm just wondering if it might be the settings we have with the chat, which we have had from previous meetings, that might not be showing up. So apologies if that's the case.
Brett's here. I'm in the car, so it makes it hard for me to type anything, but mine's stomach cancer.
Okay.
Jan here. I put it in chat too about pancreatic cancer, but I don't know if it went through.
We've got the chat. It's all good. Thank you.
Yeah. Okay, I might continue on. Thank you to those who were able to either pop themselves off mute or share in the chat. So what I will cover today is nutrition and your upper GI tract, nutrition challenges of upper GI cancers and treatment, managing symptoms including digestion and absorption, weight changes and energy levels, practical tips, alternative diets and complementary theories, and of course, as mentioned, plenty of time to have your questions answered at the end. So the upper GI tract consists of the esophagus, liver, bile ducts, stomach, pancreas, and gallbladder, and they all have valuable and unique functions in how our body processes, digests, and absorbs food. This slide describes the role of the esophagus, also known as the food pipe, which is important for the passage of food and fluids. So swallowing can become difficult or painful if the esophagus becomes swollen, inflamed, or damaged. An esophagectomy, which is a surgical procedure where part of the esophagus and stomach is removed, involves pulling part of the stomach up into the chest and reattaching it. So this reduces the stomach capacity and potentially may cause reflux. So the gastroesophageal sphincter plays an important role in preventing the backflow of food, fluid, and gastric acid into the esophagus, which is particularly important for managing reflux symptoms. The role of the stomach is to aid in digestion, and the stomach plays a dual role in both breaking down food through chemical digestion using enzymes and gastric acid, and mechanical digestion through the churning of food to mix it with digestive juices. The stomach not only acts as a reservoir for food, but also absorbs essential substances like water, vitamins, and some medications. However, medical conditions sometimes require surgical interventions like a gastrectomy, which reduces the stomach's capacity and can lead to complications such as dumping syndrome, where food moves too quickly into the intestine, causing symptoms like nausea and malnutrition, which is a pretty common side effect if the pyloric sphincter is lost, and this is relevant for someone who's had a gastrectomy or a Whipple's procedure. The liver is an essential organ in our body that plays important roles in digestion, metabolism, and detoxification. So the liver produces bile, which is a digestive juice that helps break down fats. Additionally, it regulates the storage and release of carbohydrates, which fuels our body and maintains our energy levels throughout the day. Beyond digestion, the liver is pivotal in detoxification. It processes a wide array of substances, including medications, nutrients, and wastes, ensuring that harmful toxins are safely removed from our body. However, liver damage can significantly impair these functions. Damage to the liver alters its ability to manage waste products and disrupts normal metabolic and energy processes. The pancreas is important for two main functions, one being the exocrine function and two being the endocrine function. So when it comes to digestion, the pancreas produces enzymes known as lipase, amylase, and protease, and these are all important for digesting and absorbing the food that we eat. The pancreas is also important for insulin and glucagon hormones, which are involved in blood glucose regulation. So understandably, if there is damage to pancreatic tissues through tumours, associated cancer treatment or surgery, this can all interfere with the digestion and absorption of nutrients, as well as the maintenance of our blood glucose levels. So when it comes to pancreatic enzyme replacement therapy, known as PERT or as CREON, as some of you may know, this is such an important area of pancreatic cancer management. So to paint a picture of how PERT works, is if you could imagine that our macronutrients, including protein, carbohydrates, and fats, are in a long chain or a necklace, where our pancreatic enzymes work effectively to break down this chain into smaller links, and the links can be absorbed by our intestines and body. And this means a few things: that one, we can absorb the energy to function; two, we are able to store and preserve our body weight and lean body mass; and three, our fat stores, nutritional status, and our bowel habits are generally normal. But if we compare that to when there is a malfunctioning pancreas or insufficient digestive enzymes are present, this means that long chain doesn't get broken down into links, and it remains a long chain that is too long to be absorbed by our intestine. And what this means is that what goes in goes out. So this often presents as increased bowel motions, presenting as pale, foul-smelling, oily, and or floating stools, which is a sign of fat malabsorption known as steatorrhea. Associated with pancreatic insufficiency is weight loss, nutritional deficiency, malnutrition, and of course fatigue and weakness, because our body is not able to absorb the nutrients of food that you or your loved one is most likely working really, really hard to eat. So blood glucose control and the role of the pancreas in managing our blood sugar levels are important aspects of our metabolic health. If the pancreas does not function properly, it can lead to imbalances in blood sugar levels, resulting in either hypoglycemia, so that's low blood sugar, or hyperglycemia, which is high blood sugar. So when blood sugar levels are too low, symptoms such as shakiness, nervousness, lightheadedness, dizziness, and a fast heart rate can occur. These symptoms are the body's way of signaling the need for more glucose, so that means more energy. Conversely, high blood sugar levels can lead to blurred vision, frequent urination, increased thirst, headaches, tiredness, difficulty concentrating, and unexpected weight loss. Interestingly, some symptoms of low and high blood sugar can overlap, which can make it challenging to determine whether blood sugar levels are too low or too high. And it is recommended to monitor blood sugar levels and consult healthcare professionals if these symptoms arise, ensuring accurate diagnoses and appropriate management. So upper GI treatments that patients with stomach cancer have received usually involve either radiation, surgery, chemotherapy, as well as a targeted drug therapy. And it's pretty common for people to have more than one of these, for example, having surgery as well as chemo. So which of the following treatments have you received or are planned to receive? And you can select more than one option. Again, feel free to pop it in the chat if the chat is working, or pop yourself off mute. So someone said
Hi.
Yes.
It's my mum who had stomach cancer.
Yeah.
And she actually did have chemotherapy, but unfortunately she has now been transferred to palliative care. It's terminal.
Yeah.
There's no surgery, no further treatment.
Yeah.
So she's at home, not in palliative care facility, but yeah, that's where she's at the moment. So
Thank you for sharing that.
Hi, hopefully you can hear me now. My name's Matt Marshall. I'm currently actually right at this very moment, I'm in cancer ward, receiving FLOP for esophageal cancer.
Okay.
Yeah.
Thank you. Thanks for sharing. So it seems like there's a bit of a mixture between pancreatic, stomach, chemo, esophagus. Matthew, would you be okay to pop yourself on mute?
Sure.
Thank you. Thank you. All right, I might continue on. Thank you for those who went off mute or popped it in the chat. So it seems like there is an array of different conditions that people are going through or their loved ones are going through. The upper GI surgeries will depend on the location of your tumor. So an esophagectomy is where the esophagus is resected and stomach is stretched up to meet the top part of the esophagus. It becomes longer and more narrow, so more like a sock than a bag. And this can cause people to experience reflux, stomach feeling full, nauseous, or vomiting. If someone has a stent, they insert mesh, so a plastic or other material to expand and keep open the passage of the food pipe. And dilation is similar to the stent, but not using a material. So it stretches the pipe to allow more space, to allow more food and fluid to pass through. And then a partial or total gastrectomy, which is some or all of the stomach is removed. And as I mentioned before, stomach is important as a reservoir and a processing unit of food. So removal can significantly impact the way we digest and absorb food. And these surgeries present uniquely. They present unique nutritional challenges, which we will discuss shortly. So I would really encourage you to download any of our upper GI nutrition guides that are available through this link on the screen. And you can use that free code Pancare to get access to it. So chemotherapy and biological therapies are common in upper GI cancers. Before surgery, this treatment is commonly used to manage symptoms effectively. And this means that less tissue needs to be removed during the operation, as the chemotherapy has already helped control the disease within the organ. It can be used postoperatively as well to ensure that the remaining cancerous disease or cells are under control. And because chemo is a systematic treatment, it can impact the whole body. So side effects are widespread and not isolated to the pancreas or the surrounding organ. So nausea, vomiting, changes in taste and appetite, fatigue, mouth ulcers, diarrhea, or constipation are all common symptoms. And because of the potential to irritate or cause damage to the lining of the GI tract, anywhere from the mouth all the way through to the gut can cause damage to the mucosal lining, such as mucositis, colitis, and altered bowel habits. It's important to be aware of potential interactions that can happen. So this includes how nutrients, herbal products, and supplements might interact with the chemotherapy. And antioxidants are great at repairing cell damage. However, when undergoing treatment that is trying to damage the cell, it's important that we don't overdo the antioxidant load. So it's advised to avoid high doses of antioxidants for 2 days either side of the chemotherapy. And likewise, probiotics are important to consider in the context of neutropenia. So if someone is likely to become neutropenic post-chemo, it is important that we encourage them to avoid probiotic supplements because of the artificial introduction of bacteria into a system that is immunocompromised and vulnerable. So most people will not know if they are neutropenic or not. So I would encourage you to ask your treating team, whether that's your chemo doctor or nurse, for any idea of if you are likely to become neutropenic and when in each chemo cycle, so that you can be extra safe and cautious during this time. And herbal supplements, it's important to check of any interactions prior to taking, and we want to avoid anything that might interfere with the therapy that we know really works. So radiotherapy and chemoradiation are a combination of both is common from a disease control perspective. They use ionizing radiation to damage or destroy cancer cells. And so because the radiotherapy is delivered in a precise way, any associated side effects is generally confined to the tissue that it's targeted. So yes, the pancreas, but also surrounding organs that might get in the way of the treatment field. Side effects are isolated to the abdominal region, so nausea, vomiting, changes in appetite, and sometimes changes in bowels, depending on the treatment, are common. And because the pancreas can be acutely damaged, there can be some fat malabsorption and nutritional blood glucose challenges that happen through pancreatic damage from the radiation. And because radiotherapy works by damaging cancer cells, and there is a theoretical risk that antioxidants will protect these cells, we encourage avoiding antioxidant supplements, particularly in high doses, and ensuring that patients are aware and understand that association. It's advised to avoid high doses of antioxidants for 1 week either side of the radiotherapy. And chemoradiation is where chemo and radiation are used in conjunction. So chemotherapy is used as a radiosensitizing agent, and the chemo actually makes the radiotherapy more effective. It's really important during this to be linked in with a dietitian if you are having radiotherapy to your digestive system, ideally before you start treatment. So when it comes to managing symptoms, the nutritional symptoms in upper GI cancer are profound. They vary based on the type of treatment you are having, and the next slide I will go into more detail about this. So here is a diagram that demonstrates some of the more common side effects associated with upper GI cancer treatment. And how we go about managing these is really important we do it on an individual level. Every patient will have unique combinations of nutritional impact symptoms, and they can be really challenging to manage in conjunction and can impact what an individual can eat and drink comfortably. So one of the first symptoms might be dryness in the mouth, which is really common with chemo. So we recommend artificial saliva's Xylomelt tablets that attaches to the saliva glands that helps to promote saliva production. Moist foods and changes in texture and fluids is important as well to consider. Taste changes can be so debilitating and particularly associated with chemotherapy. And again, no one size fits all. It's advised to switch to wooden or plastic cutlery and making sure that your mouth is clean and fresh prior to eating. Pain on swallowing. So with radiotherapy and chemotherapy, mouth ulcers may present. So it's recommended to choose soft, moist, or pureed foods to avoid further trauma to the mouth and throat. Nourishing fluids are helpful. Medications to manage pain, at least for a mealtime, so you can get enough food and fluids in. Reflux is also common, particularly if there's a damage to the esophagus or the stomach, or if there have been a surgery that has removed the valve or sphincter that connects the esophagus to the stomach. So anti-reflux medication is particularly important. Dietary changes are helpful too, so avoiding acidic, spicy, greasy, or fizzy foods and fluids. Being mindful of positioning, so trying to remain upright for 30 minutes post-eating, and avoiding overfilling the stomach, so that could be focusing on smaller, more frequent meals. Nausea and vomiting are very common. They shouldn't be accepted that you just have to put up with it. Antiemetics are frequently prescribed, but from a nutrition point of view, we advise to avoid foods that smell. Choosing foods that are cold or at room temperature are better than warmer foods with a fragrance, and smaller, more frequent meals of bland and starchy foods can be helpful. Fat malabsorption is very common in this population group. So pancreatic enzyme replacement therapy is really important to have at the front of your mind in any pancreatic cancer case, even with surgery. Changes in bowels are important to be aware of, and this can be related to fat malabsorption, but also intolerances and inflammation in the lining of the gut can make diarrhea quite common. Particularly in chemotherapy cases, we need to be aware of vitamin and mineral malabsorption, particularly if there are any pancreatic insufficiency, meaning that fat is malabsorbed. Fat-soluble vitamins is important to be replacing. Dumping syndrome is a nutrition consideration that we want to be able to assess for and manage well, because both early and late dumping symptoms can be debilitating and can often disguise other issues. Being aware of the impact of the pyloric sphincter is key. Early dumping syndrome is related to the lack of storage capacity of the stomach, so it can cause cramping, nausea, fullness, and diarrhea, which can result from esophageal, gastric, and pancreatic resections. It is related to food moving quickly in our small intestine, and it can be classified as early as 15 to 60 minutes post meals. And late dumping happens between 1 to 3 hours post meals, which is related to rapid absorption of glucose or sugar, causing palpitations, fatigue, headache, sweating, or shaking. And if you've had any surgery to your stomach or a Whipple's procedure, it would be advised to ask your surgeon if you're at risk of dumping syndrome. As well, it's important to talk to a dietitian about managing this, including talking about meal and fluid timing, low glycemic carbohydrates, and hypoglycemic management. And constipation, if medically caused, needs to be medically managed, so laxative or aperients, but from a diet perspective, ensuring enough fiber, fluids, and regular intake is recommended. And how would you describe your body weight based on 1 to 4? And if you feel comfortable, please share your response in the chat or go on unmute like we've been doing. So someone has said, my weight is quite stable. I've lost weight recently. Lost weight recently.
I'm not sure really where my mum's weight is at. She's definitely lost weight, but not very, very recently. So
okay. Thank you. So it seems like most people are in that lost weight category. Some are not sure of how much, but it's pretty common for weight loss to occur. I'll move on to the next slide. So it's important to understand how to meet your nutritional needs, which can be quite challenging, especially if your appetite is low or you're experiencing other side effects, like we discussed in the earlier slides. Energy and protein play a role in preserving lean body mass and strength. So they are not only essential for tolerating treatment, but also for maintaining functional capacity and aiding in your recovery and long-term wellness after cancer treatment. In the next few slides, I'll outline 3 key steps to building a nutritionally complete meal And these include incorporating a protein base, adding healthy fats, and choosing a low glycemic index carbohydrate. It's also important to monitor and track your weight weekly, and this helps us observe trends and make necessary adjustments to your diet to better support your health during and after treatment. So step 1 would be having plenty of protein to support and preserve lean body mass and prevent malnutrition. There are excellent sources of protein from both animal and plant origins. Animal proteins such as chicken, lean meats, and turkey are well-known options. For those who prefer or require a plant-based alternative, proteins like tofu and legumes are equally beneficial. And for some individuals, meeting protein needs through food alone can be quite challenging. And in this case, protein supplements may be recommended. Us dietitians at Oncore can provide personalized guidance to ensure that the choice of supplement is appropriate for your specific health needs and dietary preferences. So step 2 is making sure your meal includes a healthy fat, ideally focusing on omega-3 poly and monounsaturated fats and oils, as these are health promoting and have anti-inflammatory effects, which include foods such as avocado, plant-based oils, nuts, and seeds. And for those who may be requiring pancreatic enzyme therapy, known as Creon, it's important to know how this works, which you can download our Creon guide for further information or seek guidance from one of our dietitians about the dosage and timing. Creon is required with any food or fluid that contains fat or protein, including milky drinks and nutritional supplements. It's important to know that you don't need Creon with food or drinks that contain virtually no protein or fat. So this includes things like fresh, dried, or canned fruit, jelly or sorbet, sweets, so boiled lollies, mints, chewing gum, soft drinks, juices, cordials, clear soup or broth, and tea or coffee with just a dash of milk or some sugar. So PERT, or pancreatic enzyme replacement therapy, or Creon, is such an important part in the pancreatic cancer, as I've mentioned throughout this presentation. A few hot tips are firstly that Creon only lasts 20 minutes, so it has to be taken at the start of the meal. And if you know that your meal is going to last longer than 20 minutes, then a second dose should be taken. We want to make sure that when you do eat, that you are absorbing the fat-soluble vitamins, which is where Creon comes in. It's important to not restrict fat intake and adjust the dose of Creon accordingly. Creon is enteric coated, so they are designed to resist the breakdown by the acid in the stomach. In some cases where you may be unable to swallow the tablet, you can break it open and pour the granules into something acidic and soft that you don't need to chew, such as an applesauce or a pureed fruit. This allows the granules to pass through the small intestine where they can do their job effectively. A very rough dosing guide, and I say rough because it needs to be adjusted to each individual. So a good starting point would be 1 times 10,000 international units of Creon for 6 to 8 grams of fat, and 1 times 25,000 international units for 15 to 20 grams of fat, which can be adjusted up or down accordingly, depending on your individual symptoms. Creon does interact with antacids and supplements that contain calcium or magnesium, so it's important that we take them separately. And Creon is porcine, so it's derived, so it's important to be mindful if you're a vegetarian, vegan, or for cultural reasons, or have a pork allergy. So the lower GI carbohydrates are important, not only for blood sugar control within our pancreas, but also for energy levels and fatigue. So carbohydrate sources include breads, cereals, grains, pasta, rice, noodles, fruit, starchy vegetables, so potato, sweet potato, any dairy products, milk, yogurt, ice cream, custard, nuts and seeds, and any baked goods, so any sweets, cakes, biscuits, lollies. However, understandably, as you can imagine, these carbohydrates are not all equal. And one way that we can understand carbohydrates better is by using the glycemic index. So there is high GI carbohydrates and low GI carbohydrates. And the high GI carbohydrates are outlined in red on the graph, where it spikes blood sugar levels, and around 1 hour later, the blood sugar levels drop, noticing increased fatigue. And these foods include sources such as sweet cakes, biscuits, chocolate lollies, potato chips, corn chips, ice cream, custard, dairies, fruit juices, soft drinks, cordials, honey, jam, white bread, or processed goods. Whereas the lower GI carbohydrates generally gradually increase blood sugar levels. However, they remain sustained over a few hours to provide ongoing energy, as you can see in the blue on the graph. And these foods include sources such as whole grains, such as oats, quinoa, whole grain breads and pastas, starchy vegetables such as sweet potatoes, corn, or pumpkin, legumes such as chickpeas, kidney beans, and peas, nuts and seeds, dairy products including milk and yogurt, and fruit including the skin and seeds wherever possible to increase the fiber content. And then it hits 3 p.m. and this 3 p.m. slump is often linked to our carbohydrate choices. It's important to avoid sugar highs and lows when you're already feeling fatigued during cancer treatment. If you're interested in learning more about the glycemic index, I encourage you to explore our Oncore Nutrition GI Guide. And this resource is designed to help you understand how different carbohydrates affect your blood sugar levels. And additionally, the guide includes a practical shopping list to assist you in making informed choices when you're at the supermarket. So eat whatever you feel like. We hear this advice often during cancer treatment, often well-meaning, but sometimes reasonable. However, when you feel like this, you won't feel like this. So preparing healthy meals and eating as you usually would. One thing that is really common in our cancer treatment, or in any cancer treatment, is that people are encouraged just to get by and try and eat what you feel like. So when you're feeling really low and fatigued, it's really hard to eat things that will make you feel better in some way. So this advice may not be super helpful because what you need may be different to what you feel like, but sometimes more realistic and helpful advice could be having smaller, more frequent meals instead of 3 big main meals. And it's important to note that the more frequently we eat, the more frequently our bodies will expect food, and this can help preserve our appetite. You may have heard of commercial varieties of oral nutritional supplements, such as Sustagen or Ensure. And however, these can be made DIY at home with high energy and high protein ingredients, such as adding ice cream or milk powder or nut butters into milk. And in the instance where you can't meet your food requirements alone, you may be recommended for enteral feeding, which can be classified as nasogastric feeding, gastrostomy feeding, and jejunostomy, which are all specialized liquid nutritional formulas delivered directly into the stomach, duodenum, or jejunum via a tube. So getting support with meals is really important because food is more than just nutrition. It's family, community, celebration, joy, and pleasure, connection, friendship, cultural and religion, and so many other important things that extend far beyond vitamin and minerals. So if all that you can order at the restaurant is a hot chocolate or a soup with your crayon, then make sure you lap up all of this goodness. If you would like to know more about how to optimize your energy and protein intake, we have an Oncore nutrition guide available to you that you can find at this link using the Pancare code for free access. So has anyone ever Googled how to stop hiccups? And if you would like to read the strategies that come up in Google, you can see that they are pretty unusual. Likewise, if you were to Google a dietitian, you would be led to believe that we all roll around in white lab coats and exist entirely off diets of apples. And likewise, if you were to Google diets to cure cancer, you will be hit with some interesting and misleading results. That many diets do promote themselves to cure cancer. So it's important to know that there are no diets known to cure or prevent cancer. If any diet is promoted that is promising, it is not accurate. It's important to highlight that everybody does eat. So everybody is an expert in some level about food, but that doesn't mean they are an expert in food and how it relates to you. It's important to seek advice from an unbiased health professional with your best interests at heart and understand your unique needs. It's important to eat well, but to promise a cure is very misleading and dangerous. Alternative diets can be harmful to your health, make side effects worse, and can be demandingly financially. And did you know that up to 60% of current anti-cancer agents are derived from natural sources such as plants and microorganisms? Ginger may help settle nausea. Vitamin D, it's good to get a blood test to check your levels, and it's only needed to be supplemented if you're low. Probiotics, look for one that has the L. rhamnosus strain. It's been shown to be helpful in liver, gallbladder, and esophageal cancers. Again, as I mentioned earlier, to avoid if you are neutropenic. Antioxidants from food include diets that are rich in vegetables, fruits, whole grains, nuts, and seeds, which can help to prevent and repair cell damage. Protein powder and supplement aiming to have greater than 1 scoop per day. And it is recommended that you talk to us or your doctors before considering any specific supplements. So where to go for more information? Firstly, your treating hospital. There is a Pancare support line with the number up on the screen. There is the Cancer Counselor information and support with the number up on the screen as well, and any accredited practicing dietitian. So in the top right-hand corner of this slide is the World Cancer Research Fund, which recommends that anyone with a cancer diagnosis, whether it's past or present, should seek support from a dietitian. With that in mind, everyone in this room would be eligible to receive what's called a chronic disease management plan through the GP, which gives you access to Medicare rebates of up to 5 allied health visits per year, including consults with a dietitian. At Oncore, we offer new clients a one-off free 15-minute phone consult to touch base with one of the dietitians and chat through any concerns or dietary questions that you may have, which can be booked online or by giving us a call at the number on the screen.